Hello my dear students. Today we are starting one of the most basic yet most important instruments in pathology and microbiology, the compound microscope. Whether you are an MBBS student or pathology resident who has recently joined in the residency in pathology, if you understand the microscope properly, half of your practical fear goes away. Today we are going to discuss the compound microscope. This topic is very important for second year MBBS students, especially because it is commonly asked in the first terminal pathology practical examination. And also for the newly joined residents, as when you go to the residency, many of you will not be able to understand how to use a microscope. Let's understand this in a very simple and a practical way. What is a compound microscope? Let's break it down. Microscope is composed of two words, micron and scopios, where micron means small and scopios means to look. So, a compound microscope is an instrument used to visualize very small objects like cells and tissues, which cannot be seen by a naked eye, but using two lenses at the same time. And this feature differentiates it from a simple microscope, which uses only one lens for magnification. In compound microscope, one lens is close to the specimen and the another lens is close to your eye. Together, these lenses do compounding and produce a magnified image. Second year MBBS students, in your pathology practicals, you are expected to identify microscope parts, adjust focus properly, and examine slides correctly. Coming to the main systems of the compound microscope, it can be divided into three systems. First, the mechanical system, then the optical system, and then the illuminating system. We will go through each system while you can see the actual parts on the screen. Also, microscope I am showing you here is a binocular. What does this mean? It means we will be using both eyes to see the objects. Mechanical system of a microscope composed of the parts which give support to the microscope and helps in focusing the slide, such as base, which supports the microscope, the arm which connects the base to the upper part and used while carrying it, the stage where the slide is placed. The part where slide is placed on the stage can also contain a clip to help to fix the slide. If a mechanical stage is present as shown here, the knobs are also there which allows left and right movement, forward and backward movement, and this helps in systematic examination of the slide, which is very important in pathology.
The head holds the eyepiece and revolving nosepiece at a correct distance.
The nosepiece, which helps the objective lenses and allows easy change in magnification. The knobs. The bigger one is the coarse adjustment knob, which is used for initial focusing, mainly with 4x and 10x objectives. And then the smaller one is the fine adjustment knob, which is used for precise focusing, especially when 40x and 100x objectives are used. This distinction is commonly asked in viva. Also remember, when you are making coarse adjustment of the stage by using the bigger knob, you can see the stage moving upward and downward. Coming to the optical system of the microscope, these are the parts in a microscope which helps in the magnification of the image. So what can be these parts? Eyepiece. The eyepiece usually has 10x magnification. And the objective lenses. There are usually 4 objective lenses present in the microscope. Commonly used objective lenses are of 4x for scanning, 10x for low power, 40x for high power, and 100x for immersion for maximum resolution. Please remember, all these objective lenses has a colored band on it. When you see the 4x objective lens, it usually has a red color band on it, whereas 10x has the yellow band on it, 40x has the blue band on it, and 100x commonly has a black band on it. You need to remember all these band colors to identify the lenses correctly. Okay. Also remember, whenever you are scanning a slide, whenever you want to look into a slide, always start from the low power and go to the higher power gradually. Meaning always start from the scanner view using the 4x. Also, another thing which is commonly asked is, what is the magnification if you are using the 4x lens? Or what is the magnification if you are using 10x lens? So, please understand the magnification power of your eyepiece is 10x, and if you are using a 4x lens, 10x multiplied by 4x is equal to 40x. So whatever you are seeing, whatever you are looking at, is you are seeing that thing at a 40x magnification. Likewise, if you are using a 100x magnification lens, multiply it with the power of your eyepiece, which is 10x. What does this mean? You are seeing the object as a 1000x magnification, right? So please remember this. This gives you an extra edge in your practical exams. Another pro tip I will give you is 100x objective lens is an oil immersion objective lens. We usually use cedar wood oil for 100x objective lens. Only put 1 drop of oil on your slide while using 100x magnification. Do not put a lot of oil on the slide. It will not make things easier. Neither will you see something extra magnified by using a lot of oil. A very important concept we need to know here is field of view or the field diameter. Please remember, as magnification increases, the field of view decreases. This means low power shows a larger area and high power shows a finer detail. So when you are using the 4x, you will see a larger area of the slide through the lens. But when you are using the 100x objective lens, you will be seeing the smaller area of the slide. But details will be finer in 100x and not in 4x.
To calculate field diameter, divide field number which is mentioned on your eyepiece by the objective magnification. Usually the field number which is mentioned on your eyepiece is 20 mm. So for example, if you want to see the field diameter of your 4x objective lens, divide 20 mm by 4x and it will be 5 mm. So field diameter for your 4x objective lens is the 5 millimeter. So now you understand the field diameter, also known as field of view, is the circular area that is visible when you look through the microscope. Because the size of objects is different at each magnification, you have to calculate the diameters of the field of view at each magnification. This is also called calibrating your microscope. I hope you don't have any confusion in this.
Condenser. The condenser focuses light onto the specimen. The iris diaphragm controls the quality of light entering the condenser. Proper adjustment of these two is necessary for good contrast, clear image, reduced eye strain. Coming to the illumination system. These parts control the amount and focus of light. Most microscopes use a white light. A yellow filter is sometimes used to improve contrast and reduce eye fatigue during prolonged slide viewing. Now, residents, this depends on you whether you want to buy a microscope with white light or whether you want to buy a microscope with yellow light, but yellow light will definitely give you good contrast. The microscope I am using currently has a white light. So this was an introduction to compound microscope, and now I hope you finally know how to use a microscope, which part is meant to do what function, and you will be confident in examination in your practical vivas to answer anything related to what is taught today. In next video, we will be covering anemia and its morphological classification, which is yet another very important topic. Till then, keep revising smartly. I know first terminal examination for second year MBBS students are just about to come in the month of February. So thank you for watching. Keep revising smartly and see you in next video. Please like and share this video and subscribe my channel for more such videos.